Actually, I've been retired over 20 years now, and my career as a nurse has pretty much come to a stop. Although I would say the first 15 years of my retirement, I maintained relationships with people from many of the areas I worked in, but once COVID hit, things sort of came to a close and some of the organizations have folded. I still belong to several nursing and professional national organizations. I stay in touch, but I'm not active. I also would like to mention that I did stay active with Rescue Mental Health Crisis, and I had been involved with them since they started in the mid-'80s, and then ended up in my retirement being on their board, and they have just recently closed. So that too now is in my past. Now my interest really is centered on my family and myself, and sort of keeping myself physically active and healthy as I go on into old age, because I'm in my mid-'80s right now. Well, starting back with my family, my nuclear family, they always urged us to go on for education, and both my parents were not able to complete college during the Depression, and yet they were highly intelligent people. And actually the University of Toledo has been connected with my family from my aunt's graduation in the 40s, my brother's getting his Ph.D. in the late 60s, my husband's MBA in the early 70s, and then both my children have had degrees from UT, and myself, and then now I have two granddaughters in graduate schools, two different graduate schools at UT. So we're sort of connected, and we joked that we were a rocket family, but I guess we are. This is an interesting question, and I just finished writing my sort of my biography under Storyworth.com, and in it I discovered that a lot of this came from my childhood. I always wanted to be a nurse, and as a young girl I collected like the Cherry Ames student nurse books, and I had my Aunt Virginia that graduated from UT was a nurse, and I idolized her. So I think that was my initial influence. But I would say that I wanted to be a teacher at one time, but when I really looked at it, it was so that I could have interesting bulletin boards for the students. And I think that must have been a third grade boredom with how the life was treating me in the classroom. I worked as a nurse for many years. The last 20 years was at what was at one time MCO, now UT, teaching in the College of Nursing. And that level, and then also getting my doctorate. So once all that was done, the education was done, I was working with students on the undergraduate and graduate level, and then I started delivering papers, writing papers, presentations. Everything was being met. It's been a very gratifying career for me. But I think it all started as a kid. Well, I was very surprised. I would say that. It's an honor, and I think my children are more proud of this than I think I am. And actually, since it's come after my career, all I can say is it's sort of overwhelming to think of it. Nursing has changed so much over the years, and I'm just really honored, very honored to have been selected. Having accomplished all of my education in nursing, including the Ph.D. in nursing, that gives me satisfaction that I did my best. I also was active academically in the 80s and 90s when it was sort of nursing's heyday. And we were developing nursing theory, doing research, publishing what we had found out, working with the students. That I'm really proud of. And it was activity I was probably limited in doing in the clinical setting, on my own in the health department. My main role was in community health before that, the first 15 years or so. So I would say that would be the proudest. And having the further education, it did open me up to being active on national and international groups where I met people from all over the world and delivered papers, in other countries. A life I never would have had back at the health department. So that's probably, I would say, would be my greatest accomplishment. This may sound strange, but I would like to recognize the UT Library because when I was going to Wayne State, I lived at the UT Library. And a very interesting incident happened one day when I was learning the ropes of the library, and I needed help with the copy machine. And one of my an undergraduate student who had gone to school with my son and daughter in grade school was there, and I asked her if she would help me, and she did. And when I thanked her, she looked at me and she says, "Well, Mrs. Anderson, we students got to stick together." But that really, the library just had everything I needed. The one person that I must recognize is named Martha P2, Dr. Martha P2. And I met Martha in the late 60s at the Toledo Health Department, and she was supervising public health students from U of M at that time. And then I got married and moved away, and then I came back, and Martha also then, her husband was transferred back to Toledo, and she had just joined the faculty at MCO in the nursing program. And when she came, and this was after my husband had died, so she came to the health department, and she with new students when she came back to Toledo, and this is the late 70s. And she looked at me and she says, "Well, I didn't expect to see you still here," and that sort of got me thinking, well, I did have plans on going to graduate school, but I had 2 kids and I had a job I loved. I was very comfortable staying here in Toledo, but that did get me to leave the health department, go to the county health department, and then she got me interested in urged me to go on to graduate school, which I did. I did not major in community health, that was her area, but I went into psychiatric nursing because I had figured out what I really wanted to learn was how to teach nurses to be critical thinkers and to have empathy. Because if you don't have that, you're not going to be very effective working with people, So that's why I went into psych. But I did take, Martha really sort of chaperoned me through graduate school, including forcing me to become a better writer. She just guided me all the way through my career. Then on the faculty, she was community health, I was psych with a community health background. We ended up creating joint clinical groups with the homeless population in the shelters here in Toledo, and opened up 2 clinics that we staffed with students. It was a wonderful experience for the students. And Martha was instrumental in the very beginning of the HIV crisis. And so she just was a marvelous person. She still is. And her enthusiasm is very contagious. But I tell you, I learned a lot. And we also presented in Madrid, just all kinds of exciting things that we were able to do. But she would be the one that really Actually, she would, you just wanted to be just like her, you know. First of all, I think as a new graduate, you probably have, well, or you might still be in school. So select a career that you are interested in, that you can get excited about. But don't worry if you find out in a couple years it's not what you really wanted to be. Don't be afraid to change, to make a change and move on. The other, I would say that when you get a job, learn everything you can about that place, wherever you're working, and be a team player. The other thing that I think is important is that when you go to work, you work. When you go home, you don't bring your work home. You have to have a life outside of work, and you have to have activities that make you happy. And you also have to have activity, like physical activity, whether it's exercising somewhere, walking in the park, reading. That's not going to be activity, but it's something that you like, you know, that gives you peace of mind. Well, I hope people will remember me as being a fair person, non-judgmental. I think I'm an inclusive person. Now that might not be how others see me, but I sort of think that that's how I've been. I also have a scholarship with UT in the School of Nursing. And it's meant for nursing students who are interested in working with psychiatric patients or any vulnerable population. And the way it's funded, I think it's going to last when I have departed this earth, you know, so I'm proud of that, and but I don't know that they know who I am, you know, so I don't know who's going to remember me besides my family and my friends.